Hi, my name is Bruce Robinson. I'm a doctor that specialises in lung diseases such as COVID-19, but also a professor who leads a research team that is studying COVID-19 and in particular ways that we can communicate well with multicultural communities about this disease to give more information that's accurate, information about vaccination, but also to help when there's an outbreak, to help multicultural communities avoid this disease. Turns out that multicultural communities are more at risk of getting the disease, of getting severe disease, and also to not be vaccinated. And we would like to talk about that with you. And this issue is really urgent at the moment because soon the borders in Australia are going to be opened up, so there will be community transmission. And it turns out that the majority of people that aren't getting vaccinated at the moment in the cities are people from multicultural communities. And a lot of that is about information and misinformation, and we're here to help with accurate information, and I'll talk about that now. Our program is called EDICT, which stands for Early Digital Intervention in COVID-19 Therapy, and basically it's about communicating digitally to provide accurate information. So why is it that multicultural communities are more hesitant about getting the vaccine? Well, there are two main reasons, and one of them is simply a lack of information in their own language. And once people understand the importance of the vaccine and how safe it is, they can avoid some of the misinformation and get vaccinated. And that's been shown elsewhere to be very effective. And that's one of our jobs, is to give you accurate information. The second reason is really about misinformation. So I know people can get a bit afraid and a bit anxious about this vaccine because they hear information like it's going to stop you having babies, or it might cause cancer, or the vaccines haven't been well tested. None of this is true, but it's important that we get accurate information to you so that you're not influenced and made to feel anxious by this misinformation, and we will do that. So our early digital intervention program means that we will send you accurate information about COVID-19 in your language direct to you. It's all free, it's all confidential. The email addresses do not go to anybody else, or your mobile phone addresses if you send us them as well. And we will continually update you with this information. It's information by experts from the hospital, the university. Because it's digital, it means that it's sent to you by email, or maybe by your phone, maybe as an audio, maybe as a video, as well as written material. But the important thing is it happens regularly and you get updates. For example, updates about the vaccine, updates about the disease. And here's a really important point. You're able to get updates if there's an outbreak of COVID-19 in your community, either in your region or in your multicultural community. Finally, I'd just like to say that this is entirely voluntary, and at any time you can opt in or opt out. But the whole goal of this is to be able to communicate really well with your community about COVID-19 to help protect your community from disease. And to be honest, the people in your community who are most vulnerable are the elderly. And one of the things I love about multicultural communities is just how close the communities are and how much the older people in the communities are loved and respected. And let's be honest, they're the most vulnerable to dying from COVID-19. So I think once people get the right information, avoid the misinformation, then out of love and respect for their elders, the older people in their community, they're more likely to get vaccinated. Anyway, we really, really hope that you will send us an email to the email address below, and also pass this on to your friends and family so that they too can get connected and have early information and the best, most accurate information about COVID-19, the disease, vaccinations, outbreaks. Finally, we're doing this because we really care about you and your community and the older people in your community. So please help us by emailing us, getting connected, and helping us to help you avoid COVID-19.